Hi friends, so all of you know very well regarding the drug paracetamol. So you know that it is a drug which can reduce the temperature. But there are certain drugs that can increase our body temperature. So you want to know the answer for this question, then you can watch this video, and you are watching the Nurse channel, and welcoming you all back to our channel, and you are watching the 14th series of our AIIMS NORCET examination, and the exam date is getting very nearby, and I know that you are preparing very seriously. So these videos and this series definitely will help you to prepare better for the upcoming AIIMS NORCET examination. And not only for that, we have the other series of nursing officer examinations like the SNO examinations also. So these videos will definitely help you to prepare little more better for your upcoming examinations. So before starting our video, before starting the series, I request everyone who are watching this video to subscribe our channel and support us, and kindly enable the bell button so that you will get notifications whenever we are uploading new videos. So without losing time, we will move on to the questions in the 14th series of AIIMS NORCET series. So here comes the questions. So the 14th series, you are seeing the first question in the screen right now. So first question. So recommended BP cuff size for a regular adult is. So what is the recommended cuff size for a regular adult? So the options are option number A 22 to 26 centimeter, option number B 27 to 34 centimeter, option number C 35 to 44 centimeter, and option number D 45 to 52 centimeter. So what is the recommended BP cuff size for a regular adult? That is the key point here, regular adult. So there are certain recommendations by the American Heart Association and other associations. So we will see the answer first. The answer for this question is option number B, that is 27 to 34 centimeter for regular adult. So we will see the recommendations. So the recommended BP cuff sizes were categorized based on the mid-arm circumferences. So the main thing is the mid-arm circumference. So the small adult, it will be like less than or equal to 26 centimeters. Okay, so for a regular adult, it is between 26 to 34 centimeters. This is for the regular adult, and for the large adult, it could be like 34 to 44 centimeter, and extra large adult, it may be more than 44 centimeters. Okay, so these are the recommendations, and it is based on the mid-arm circumferences. So keep in mind these values, and you can answer this question. Okay, so that's all regarding the first question, simple question. Now we will move on to the second question in the series. So the question is, how do you position a patient with autonomic dysreflexia? So here the question is regarding the autonomic dysreflexia and how you will position the patient. So the options are option number A, Fowler's, option number B, high Fowler's, option number B, C, supine, and option number D, Trendelenburg. So in which position you will keep a patient with autonomic dysreflexia? So first of all, you should understand what is autonomic dysreflexia and which position can be used. So first we will see the answer. The answer for this question is option number B, that is high Fowler's. Okay, so among this option, the answer is high Fowler's, but the exact position I will tell you now. So first of all, what is the autonomic dysreflexia or AD? So this is a potentially fatal medical emergency, classically characterized by uncontrolled hypertension and cardiac arrhythmias. Okay, uncontrolled hypertension and cardiac arrhythmia. So this occurs most often in individuals with spinal cord injuries with lesion at or above the T6 spinal cord level. Okay, so although it has been reported in patients with lesions as low as T10. Okay, so this is another additional information for you, like so above the level of T6 spinal cord injuries, there are chances for getting the autonomic dysreflexia, but it can happen for the lesions at the level of even T10. So the other causes are Guillain-Barré syndrome may also causes the autonomic dysreflexia. So this is a short note regarding the autonomic dysreflexia. So how we will position the patient? So the first step of treatment of the AD is to sit the person upright. Okay, so sit the person upright with their legs dangling and remove any tight clothing or constructive devices. Okay, so the purpose of this position is to help lower their blood pressure. So most episodes of autonomic dysreflexia go away once you remove the trigger. That means the position we can keep like sitting upright. That means high Fowler's position can be given, and along with that we can drag the patient's leg on the ground, and we can remove the tight clothings or constrictive devices. Okay, this is the first step in managing autonomic dysreflexia. Okay. So that's all regarding the second question. Now we can move on to the third question in the series. So the question is, which among the following is associated with pea soup diarrhea? So pea soup diarrhea is associated with which disease condition? And the options are option number A, cholera, option number B, hepatitis A, option number C, typhoid, option number D, Clostridium difficile. So all these conditions what I have given in the options are presented with some of the other forms of diarrhea that I will be explaining now. So before that we will see the answer for this question. The answer is option number C, that is typhoid. So we'll have a small discussion regarding all these four disease conditions and the diarrhea characteristics. So first of all, patients with typhoid may have either constipation or diarrhea. So if diarrhea is present, it may show the characteristics green pea soup appearance, which is so common in both Salmonella typhi infections and Shigella infections. Okay, so patients with diarrhea during the typhoid fever have a wide range of rates of purging, and the diarrhea is characterized by liquid stool containing large quantities of leukocytes and protein, and it is resolved by treatment with chloramphenicol. Okay, so this is in short regarding the typhoid fever and the diarrhea characteristics. So I think so many information you are getting out of this paragraph. So we will see the characteristics of stool in the other disease conditions what I have mentioned in the options. So the diarrhea which is due to the cholera, you know that it is often has a pale milky appearance that resembles water in which rice has been rinsed. Okay, so that is the characteristics of diarrhea in cholera. Then next comes the hepatitis A. So this is a small hint to remember regarding the hepatitis A stool, that is the light colored poop and dark colored pee. Okay, light colored stool and dark colored urine. Okay, so that is hepatitis A. And the final one was the regarding the Clostridium difficile. So it is often distinctly characteristics, and it can be watery or mucoid and is often greenish. So it can contain even blood also. Okay, so these are the diarrhea characteristics of these four communicable diseases. Okay, so that's all regarding that third question. I think we can move on to the fourth question in our series. So very simple question. So DASH diet aims at preventing which disease? So DASH diet, DASH. So just if you know the expansion of this, you can answer this question very easily. So the options are liver disorders, option number B, cholelithiasis, option number C, renal stones, and option number D, hypertension. So what is the answer? DASH diet. DASH diet is for obviously option number D, that is hypertension. Okay, so we know that the DASH diet or the dietary approaches to stop hypertension. Dietary approaches to stop hypertension. It is a dietary pattern promoted by the US based National Heart, Lung and Blood Institute. So the DASH diet is mainly based on fruits, vegetables, low fat or fat free dairy, whole grains, fish, poultry, legumes and nuts. So all these food items what I have mentioned here will give the recommended dietary requirement for the hypertensive patients. So it recommends reducing the sodium intake, that is very very important in controlling hypertension. Then sweets, that means in the drinks and foods, and red meat. So it limits the saturated and trans-saturated fat while increasing the intake of potassium, magnesium, protein, fiber and nutrients thought to help control the blood pressure. Okay, so in total it is a package where which will help to prevent hypertension or stop hypertension. Okay, so that is the DASH diet. Okay, so I think you got the point. We will move on to the next question. So the fifth question in the series. So the question is from the administration. DASH is the process of redistributing or dispersing functions, powers, people or things away from a central location or authority. So what is this process is called? So this is a redistributing or dispersing the functions, powers, people or things ever from a central location or authority. So the options are option number A, delegation, option number B, decentralization, option number C, distribution, option number D, autonomy. So what is the answer? So the answer for this question is option number B, that is decentralization. Decentralization. From the name itself, we can we can identify the answer. So the decentralization, it is the process of redistributing or dispersing functions, powers, people or things away from a central location or authority, and transfer of decision making power and assignment of accountability and responsibility for results. So that is decentralization. Then what is delegation? So there are chances like it can be confused. So delegation is the process by which the delegator allocates clinical or non-clinical treatment or care to a competent person, okay, or the delegate, okay. So the delegator will remain responsible for the overall management of the service user and accountable for the decision to delegate, okay. So that is the delegation, okay. So don't be confused between delegation and decentralization, okay. Then other options are like autonomy. So autonomy, what is autonomy? This means the personal freedom. So autonomy is a great respect for an individual's right to self-determination and equates freedom. So it upholds the right of individuals to make decisions about their own health care. Okay, so that is autonomy. So I think those terms which are important in the administration, I think you got it. Now the sixth question is in the screen right now. So the question is, a reactionary hemorrhage occurs how many hours post-operatively? So this is regarding hemorrhage. So you know that there are several types of hemorrhages, primary, secondary, tertiary, like that. So then another, so many classifications are there. Here the question is regarding the reactionary hemorrhage. So the options are option number A, at the time of surgery, option number B, within 24 hours, option number C, after 7 to 14 days, and option number D, none of the above. So what is a reactionary hemorrhage? When it can happen? So the answer is option number B, that is within 24 hours. So we will have a small discussion regarding this question. So primary hemorrhage, what is primary hemorrhage? Primary hemorrhage occurs at the time of surgery or injury. Okay, so that is primary hemorrhage. Then what is a reactionary hemorrhage? So it may follow the primary hemorrhage within 24 hours. So we can say like within 24 hours, but usually it can happen between usually 4 to 6 hours. Okay, so I forgot to keep a hyphen here, 4 to 6 hours, and is mainly due to a rolling of a ligature or the dislodgement of a clot or cessation of the reflex vasospasm. Okay, so these are the causes for the reactionary hemorrhage, and it can happen within 24 hours and usually between 4 to 6 hours. So then what is secondary hemorrhage? So secondary hemorrhage occurs after 7 to 14 days, and it is due to the infection and sloughing of part of the wall of an artery. Okay, so these are the reasons. So with in this screen you are getting bunch of information regarding the types of hemorrhage like primary, reactionary and secondary, and their causes also. Okay, I think that was a very informative question and very important. Now we can move on to the seventh question in the series, and the question is, name the period of fever when the body temperature has reached its maximum and remains fairly constant at a high level. So this is from the basic foundations of nursing, and slightly confusing. So read the question very carefully. Name the period of fever when the body temperature has reached its maximum and remains fairly constant at a higher level. So the options are option number A, crisis, option number B, lysis, option number C, fastigium, and option number D, defervescence. So what is the answer? So there are several types of fever characteristics or fever patterns, and so many terms associated with that there is there, so that you can refer later. So now I'll be explaining regarding these 4 terms. So first of all, we will see the answer for this question, and the answer is option number C, that is fastigium. So first of all, we will see what is a fastigium or stadium. The other name is a stadium. So fastigium or stadium of fever is the period when the body temperature has reached its maximum and remains fairly constant at higher level. So it won't come back very fast. Okay, so that is stadium. So stadium. Then what is the defervescence or decline? The other name for the defervescence is decline, and it is the of the fever. It is a fever, and it is the period when the elevated temperature is returning to normal, and the fever may be subside suddenly, that means the decline by crisis, or it can subside gradually, that is the decline by lysis. So crisis and lysis I will be explaining now. Before that, defervescence or decline you should understand. So that means the fever will be at the higher level and it will start returning to normal. It can come to normal suddenly, that means it is the decline by crisis, or if it comes down gradually, means that is decline by lysis. So what is crisis and lysis? So crisis is a sudden fall in the temperature not accompanied by an improvement in the general condition of the patient. Okay, so that is a very bad sign, and it is a danger sign and not a sign of improvement. Okay, from a high temperature suddenly it coming to the normal, that is crisis. Then what is lysis? The temperature falls in a zigzag manner for 2 to 3 days or a week before reaching the normal, during which time the other symptoms or the general condition of the patient also gradually improves. The other symptoms also will disappear. Okay, so that is a lysis. That is a good sign. Okay, so crisis is a danger sign and lysis is a good sign. Okay, in a zigzag manner it will come down. So you are getting 4 important terms regarding the fever pattern, that is a lysis, crisis, defervescence, or stadium or fastigium. Okay, so there are so many other terms that you can refer later. Okay, so that was a informative question for you. Now we can move on to the next question in the series, that is the 8th question in the screen right now. Prolonged QT interval reveals which electrolyte abnormality? So several times electrolyte imbalances and ECG changes are very important in exam point of view. So this is such a type of question. So here the question is, prolonged QT interval is associated with which electrolyte abnormality? So the options are option number A, hypercalcemia, option number B, hypocalcemia, option number C, hyperkalemia, and option number D, none of the above. So usually hypokalemia and hyperkalemia, usually we used to get questions. So here the answer for the question what I have asked is option number B, that is hypocalcemia. Okay, so these things we will see now. So the ECG hallmark of hypocalcemia remains the prolongation of the QT interval because of the lengthening of the ST segment. Okay, so which is directly proportional to the degree of hypocalcemia, or as otherwise stated, inversely proportional to the serum calcium level. Okay, so serum calcium level is inversely proportional to the ECG changes, that is the prolongation of the QT interval. Okay, so the other electrolyte imbalances you know very well, that is hyperkalemia, we can see tall peaked T wave, and in the hypercalcemia there will be short QT interval. Okay, so these two things don't be confused. Hypocalcemia, the interval will be prolonged. In the hypercalcemia, the QT interval will be short. Okay, so that's all regarding that question. Very simple, easy question, but can be mistaken. Okay, so now we can move on to the 9th question in our series. The 9th question, the most commonly manifested bleeding in DIC is? So first of all, you should understand what is DIC, that is disseminated intravascular coagulation. So there will be some or the other form of bleeding which will be happening in DIC. So the most commonly manifested bleeding is what? So that is the question, and the options are option number A, hematuria, option number B, hematemesis, option number C, hematochezia, and option number D, hemoptysis. So you should understand all these terms and you should know what is DIC, then only you can answer this question. So first of all, we will see the answer for this question. So the answer is option number C, that is hematochezia. So we will see what is DIC and how it will present. Okay. So the passage of bright red blood in the stool due to GIT bleeding from distal to small intestine will happen in DIC, and it may be the first bleeding from the DIC. Okay, so in disseminated intravascular coagulation, what we can see is the passage of bright red blood in the stool, that is known as the hematochezia. Okay, so disseminated intravascular coagulation, it is a condition in which the small blood clots develop throughout the bloodstream, blocking small blood vessels. Okay, so the increased clotting depletes the platelets and clotting factors which is needed to be control the bleeding. So it can reversely causes the excessive bleeding. So this is in disseminated intravascular coagulation, and the first bleeding that can be evident is hematochezia, that is a passage of bright red blood in the stool due to GIT bleeding from the distal to small intestine. Okay, so that's all regarding that very informative question. Now we can move on to the 10th question in our series. So this is from the nursing research. So which of the following is a probability sampling technique? So I'll be giving some options. You have to find out the probability sampling technique among the options. So first option is option number A, random sampling. Option number B, convenient sampling. Option number C, quarter sampling. And option number D, snowball sampling. So these are different types of sampling techniques which can be used. So you have to find out the probability sampling technique. So the answer is option number A, that is a random sampling technique, random sampling. So we'll have a small note regarding the probability sampling. So probability sampling means it is a technique where the samples are gathered in a process that gives all the individuals in the population equal chance of being selected. So the all individuals in the population have the equal chances to be selected for the study. So there are various probability sampling techniques. I'll tell you the names, you can refer it later. So some probability sampling techniques are simple random sampling, then stratified random sampling, systematic random sampling, then cluster or multi-stage sampling technique, and sequential sampling techniques. Okay, so these are the examples for some probability sampling techniques, and I have given the other three options in the question. That also you can refer later, because these are very vast topics and we have very limited time for preparing like that. Okay, so you can refer it later for your better preparation. Okay, now the 11th question in the series. Ryles tube typically used in the neonates are of which size? So the question is regarding the size of the Ryles tube which can be used for neonates. So the options are option number A, 12 to 18 French, option number B, 6 to 14 French, option number C, 4 to 8 French, and option number D, 8 to 10 French. So for neonates, which size of Ryles tube can be used? So the answer is option number C, that is 4 to 8 French. Okay, so 4 to 8 French. So we'll have according to the age how the Ryles tube size is differentiated. So for the neonatal period, neonatal patients, it will be like 4 to 8 French, and for the pediatrics it will be like 6 to 14 French, and for the adults like 12 to 18 French. Okay, so these values just keep in mind and you can answer this question very easily. Okay, now we will move on to the next question in our series, that is the 13th question. So this is from the cardiovascular system. So which among the following is low tension pulse? Low tension pulse you have to identify. So the first one is the pulsus durus, option number B, pulsus mollis, option number C, Corrigan's pulse, and option number D, pulsus paradoxus. So among these, which is a low tension pulse? So you know that for the pulse there are so many characteristics like volume, tension, those things are there, and those things you have to study well for the exam point of view. So here the question is regarding the low tension pulse. So the low tension pulse is option number B, that is the pulsus mollis. Okay, so we know that in the pulse, for the tension, what tension means, it corresponds to the diastolic blood pressure. Tension means it corresponds to the diastolic blood pressure, and a low tension pulse is known as the pulsus mollis, the vessels are the vessel is soft or impalpable between the beats. So the low tension means, how we can identify is the vessel is soft or impalpable between the beats. That is a low tension pulse, otherwise known as the pulsus mollis. Then what is a high tension pulse? It is otherwise known as the pulsus durus, and the vessels feel very rigid even between the pulse beats. Okay, so if it is soft or impalpable, that is a low tension, that is pulsus mollis. If it is rigid between the pulse beats, then it is pulsus durus or high tension pulse. Okay, so that's all regarding the tension of the pulse. Then other two options also I will explain now. What is a corrigan pulse? So corrigan pulse is a pulse that is forceful and then suddenly collapses. Okay, so first it will be very forceful and suddenly it will collapse. So it is usually found in patients with aortic regurgitation. Okay, so just an additional information for you, that is corrigan pulse. Then what is pulsus paradoxus? So it is a condition in which some heartbeats cannot be detected at the radial artery during inspiration phase of respiration. So the inspiration time, some beats will be missed in the radial artery. So it is caused by an exaggerated decrease in the blood pressure during this phase, and it is the diagnostic of a variety of cardiac and respiratory conditions of varying urgency, such as cardiac tamponade. So cardiac tamponade is one example, one condition where we can get pulsus paradoxus. Okay, so for important terms regarding the pulse, that is pulsus mollis, pulsus durus, pulsus paradoxus, and the last one was the corrigan's pulse. Okay, so there are so many other types and characteristics of pulse are there that you can refer later. Okay, so that's all regarding the 13th question. Now we will be seeing the second last question in our series, that is the 14th question. So regarding this question, I was explained in the, I was giving an information in the introduction of this video. So which among the following drugs can cause increase in the body temperature? Okay, which among the following drugs can cause increase in the body temperature? So the options are: option number A, amphotericin; option number B, phenytoin sodium; option number C, penicillin; and option number D, all of the above. So the answer is option number D, that is all the above drugs. Okay, so there are some other drugs also that can cause the increase in the body temperature. So the drugs that can cause body temperature are most commonly amphotericin B, then some antihistamines, then asparaginase, then barbiturates, then bleomycin sulfate, methyl dopa, penicillin, phenytoin sodium, etc. So these are the drugs, some drugs that can cause an increase in the body temperature. Okay, so that's this medicine list, just keep in mind. Okay, so with that we will be moving on to the final question in our series, that is the 15th question from the respiratory system. And the question is: accessory muscles of respiration which elevate the first two ribs is. So we have a set of accessory respiratory muscles. So you have to find out the muscle which elevate the first two ribs, and the options are: option number A, sternocleidomastoid; option number B, trapezius; option number C, scalene; option number D, pectoralis. So what is the answer? So the answer is option number C, that is the scalene muscles. Okay, so the accessory muscles of respiration, we will have a short description now. So accessory muscles of respiration include the scalene muscles which elevate the first two ribs. Okay, so the scalene function is to elevate the first two ribs. Then the sternocleidomastoid, so as the name indicates, it will raise the sternum. Then the trapezius and the pectoralis muscles which fix the shoulders. Okay, and the other parts. Okay, so scalene first two ribs, sternocleidomastoid is the sternum, and trapezius and pectoralis muscles which will fix the shoulders. Okay, so with that we are coming to the end of this topic. So we have included nursing research and nursing administration questions also in these sessions, because you know that for the SNO examinations you can expect questions from the nursing administration, education, as well as from the nursing research also. So try to watch the video till the end, and thank you all for watching the video till the end. And I request everyone to stay in touch with us, so that we will be coming with the next series of questions very shortly. And till that time, just signing out. Thank you.